Hey guys, what's up and welcome back to my channel. I started a new series on everything health with Nurse Dera, where I'll release new videos every week on health. We'll get to discuss different health conditions and how to manage them. In this week's edition of Everything Health with Nurse Dera, we'll be discussing how to shrink your fibroids naturally with diet. Now, before we get right into the video, let's have a little background of what fibroids are. So fibroids are non-cancerous growths that develop in or around the uterus. The growths are made up of muscle and fibrous tissue, and they vary in size. Sometimes these tumors become quite large and cause severe abdominal pain and heavy periods. In most cases, they cause no signs or symptoms at all. These growths are usually benign. They are non-cancerous. And we have different types of fibroids, and the types depends on their location in or on the uterus. We have intramural fibroids. They are the most common. They appear within the muscular wall of the uterus. And we have subserosal fibroids. They form on the outside of the uterus, which is called serosa. They may grow large enough to make the uterus appear bigger on one side. Then we have pedunculated fibroids. Subserosal fibroids can develop a stem, a slender base that supports the tumor. So when they do that, they are known as pedunculated fibroids. Then we have submucosal fibroids. This type is not as common as others. Types of tumors develop in myometrium, which is the middle muscle layer of your uterus. Then we have cervical fibroids. This type is very rare. They develop on the cervix, which connects the uterus to the vagina. What causes these fibroids? It is still very unclear why fibroids develop. There are no known causes of fibroids, but there are different factors that may influence their formation. We have hormones. The ovaries produce estrogen and progesterone, which causes the uterine lining to regenerate during each menstrual cycle, which in turn stimulates the growth of fibroids. And secondly, we have family history. Fibroids may run in the family. For instance, if your mother, grandmother, or sister have a history of this condition, there are possibilities that you may develop it as well. What are the risk factors of fibroids? 1. We have a family history of fibroids. 30 years old or older women with high body weight, also African Americans or generally Africans have higher risk of fibroids than people of other ethnicities. Fibroids can be symptomatic or asymptomatic, but the symptoms include heavy bleeding between or during your periods, menstrual clots, menstruation that lasts longer than usual, increased menstrual cramping, pain in the pelvis or lower back, pressure or fullness in your lower abdomen, swelling or enlargement of the abdomen, increased urination, pain during intercourse. Now, food that can help shrink fibroids completely. But before we talk about food, let's talk about lifestyle modification. Lifestyle modification is very important when it comes to healing fibroids. These lifestyle modifications include exercise, managing your stress level, reducing weight, cut or limit alcohol, no smoking, and the rest of them. The food includes fruits and vegetables. Eating plenty of fruits and vegetables generally help to lower the risk of many health problems, including heart disease and certain types of cancer. Now, in respect to shrinking fibroids, these particular fruits and vegetables are more helpful. They include apple, broccoli, cabbage, citrus fruits like oranges, lemons, and grapefruits, then tomatoes. Now, here are the reasons why these fruits and vegetables help shrink fibroids or lower the risk of fibroids. 1. We have the fiber content. Fruits and vegetables are high in fiber, which helps your body get rid of excess estrogen through your stool. Remember, estrogen feeds fibroids, so clearing out excess estrogen helps shrink these fibroids or reduce the risk of fibroids. Then secondly, we have lower BMI. Fruits and vegetables are generally low in calories, so eating more of it in place of high calorie foods will help you achieve a lower body mass index, which will in turn shrink the fibroids. Remember, higher body mass index raises estrogen. Second food on our list is low-fat dairy products. Add dairy products such as yogurt and cheese in your diet. Dairy is rich in calcium, phosphorus, and magnesium. These minerals help shrink fibroids and lower risks of having fibroids. It also slows their growth. So we have some examples of these low-fat dairy products, and they include milk, custard, yogurt, cheese, butter. The third on our list is fiber-rich foods. Fiber-rich foods binds to estrogen byproducts in your gut and stops your duodenal cells from reabsorbing them into your bloodstream. Fiber also promotes weight loss. These all help in shrinking fibroids. Fiber-rich foods include oats, brown rice, legumes, which includes beans, peas, lentils. Then we have vegetables, nuts and seeds, cocoyam, corn, yam, cassava, tiger nuts, banana, okra, guava, avocado, wheat bread, breadfruit, garden eggs, tiger nuts, dates. We have a whole lot of them. Nigerian pear, and banana, carrots, apple, spinach, and a whole lot of them. So the aim is to eat at least 30 grams of fiber per day. Try as much as you can to incorporate fiber-rich foods in your diet. The third on our list is omega-3 rich foods. We all know that inflammation is a critical component of fibroids. Omega-3 fats are potent anti-inflammatory compounds, and they are present in oily fish. Here are examples of foods rich in omega-3 fatty acids. We have fish, walnuts, snails, avocado, sardines, flax seeds, spinach, chia seeds, dates, and so on. You can see that some foods in omega-3 fatty acids are also rich in fiber. That's the good thing. Food high in iron, iron-rich foods, which includes legumes, which is beans, vegetable soup, millet, cashew nuts, potatoes, bitter leaf soup, fish and sardines, brown rice, semolina, and so on. Whole grains, which includes corn, millet, popcorn, whole wheat pastas, whole grain breads, brown rice, whole wheat, whole oats. Last but not the least is foods high in potassium, which includes bananas, potatoes, tomatoes, yam, spinach, dates, avocado, salmon, fish, goat meat, and beans. So guys, one thing about this food is you will notice that some of the foods rich in potassium are also rich in iron, rich in fiber, rich in omega-3, and the rest of them. So it's good to know these foods. Try as much as you can to incorporate them in your daily diet, and you get a positive result. Now, I can't end this video without talking about foods to avoid when you have fibroids. We have high fat processed meats, that's red processed meats. Please try as much as you can to avoid this set of foods. We have high fat dairy products. We have foods high in salt, refined carbohydrates. Now you have white foods like pasta, white bread, white rice, cakes, cookies, boxed cereals, potato chips, and the rest of them. Then we have soy, refined sugar, caffeine, and alcohol. Try as much as you can to cut alcohol off completely or just limit the intake. So with this, we've come to the end of the video. Next week, we're going to talk about why your fibroids have refused to shrink despite doing all of this. Why is it so difficult to get rid of these fibroids? That will be our discussion for next week. Don't forget to subscribe, turn on your notification so when I upload my next video, you get it. Bye.